Binge eating disorder and bulimia nervosa are two distinct eating disorders that often present with overlapping symptoms, making accurate identification crucial for clinicians. Binge eating disorder is characterized by recurrent episodes of consuming large quantities of food, often rapidly and to the point of discomfort, without regular compensatory behaviors like purging. In contrast, bulimia nervosa involves similar binge episodes but is followed by compensatory actions such as vomiting, excessive exercise, or misuse of laxatives to prevent weight gain. Recognizing these patterns in clients is essential, as each disorder requires a tailored treatment approach. Understanding the nuances between them not only aids in diagnosis, but also ensures that individuals receive the most effective care. For your licensing exam, being able to differentiate these disorders and identify their core features is a fundamental skill. To understand binge eating disorder, it's important to first look at the criteria outlined in the DSM. Binge eating involves consuming unusually large amounts of food within a discrete period, often accompanied by a sense of loss of control. For a diagnosis, these episodes must occur at least once a week for 3 months. Emotional signs can include feelings of distress, guilt, or embarrassment following the binge. Clients may also report eating rapidly, eating until uncomfortably full, or eating alone due to shame. Recognizing both the behavioral patterns and emotional responses is key to identifying this disorder. Bulimia nervosa is defined by the DSM as recurrent episodes of binge eating, followed by inappropriate compensatory behaviors designed to prevent weight gain. These compensatory actions can include self-induced vomiting, misuse of laxatives, fasting, or excessive exercise. For a diagnosis, these behaviors must occur at least once a week for 3 months. A key aspect of bulimia nervosa is the individual's self-evaluation being unduly influenced by body shape and weight. This preoccupation with body image helps distinguish bulimia from other eating disorders. Recognizing the frequency and nature of these behaviors is crucial for accurate assessment and effective support of clients. Both disorders share several noticeable similarities in the way clients experience and express their symptoms. One of the most prominent overlaps is the occurrence of binge eating episodes, where individuals consume large amounts of food in a short period of time. Emotional distress often accompanies these episodes, leading to feelings of guilt, shame, or anxiety. These challenges can significantly disrupt a person's daily routine, affecting work, relationships, and overall well-being. By understanding these commonalities, we can better appreciate the complexities involved in diagnosing and treating these conditions. Binge eating disorder and bulimia nervosa share some similarities, but there are crucial differences that set them apart. One major distinction is the presence of compensatory behaviors. Individuals with bulimia nervosa typically engage in actions like vomiting, excessive exercise, or fasting to counteract binge episodes, while those with binge eating disorder do not. Body image concerns are also more pronounced in bulimia nervosa, with sufferers often experiencing intense fear of weight gain and a distorted view of their bodies. In contrast, people with binge eating disorder may feel distress about their eating habits, but are less likely to have severe body image issues. These differences can be seen in real-life client experiences, where patterns of behavior and emotional responses help clinicians make accurate diagnoses. Understanding these nuances is essential for recognizing and differentiating these disorders, especially in an exam setting. Sarah is a 32-year-old woman who has struggled with episodes of uncontrollable eating for several years. She often finds herself consuming large amounts of food in a short period, even when she isn't physically hungry. These episodes are typically followed by intense feelings of guilt, shame, and distress. Unlike some other eating disorders, Sarah does not regularly engage in compensatory behaviors, such as purging or excessive exercise. Her eating patterns and emotional responses align closely with the diagnostic criteria for binge eating disorder. Through Sarah's story, we can observe how BED manifests in daily life, affecting both physical health and emotional well-being. To understand why Sarah is diagnosed with binge eating disorder rather than bulimia nervosa, it's important to look at the specific criteria outlined in the DSM. Unlike bulimia nervosa, binge eating disorder does not involve regular use of compensatory behaviors such as purging, excessive exercise, or fasting after episodes of overeating. In Sarah's case, she experiences recurrent episodes of consuming large amounts of food, but she does not attempt to counteract these episodes through such behaviors. Additionally, her emotional response is characterized by feelings of distress, guilt, and shame following the binges. This pattern aligns closely with the DSM criteria for binge eating disorder, highlighting how these guidelines are applied in real-life situations. Let's take a closer look at Alex's experience with bulimia nervosa. Alex often finds himself caught in a cycle of binge eating, consuming large amounts of food in a short period, followed by episodes of purging through self-induced vomiting. He struggles with persistent concerns about his body image, feeling dissatisfied and anxious about his weight and appearance. These behaviors and thoughts are characteristic of bulimia nervosa, which is defined by recurrent binge eating episodes and compensatory actions to prevent weight gain. By examining Alex's story, you can begin to recognize the signs and patterns that are typical of this disorder. Understanding these details is essential for identifying bulimia nervosa in your own clients and providing appropriate support. Alex's diagnosis of bulimia nervosa is distinguished by the presence of compensatory behaviors, such as self-induced vomiting or excessive exercise, which follow episodes of binge eating. Unlike binge eating disorder, where these behaviors are absent, bulimia nervosa involves a persistent preoccupation with body shape and weight. Alex frequently expresses dissatisfaction with his appearance and engages in actions aimed at preventing weight gain. These patterns not only affect his physical health, but also disrupt his daily routines and social interactions. The combination of recurrent binges, compensatory measures, and significant body image concerns clearly sets bulimia nervosa apart from binge eating disorder. Recognizing these differences is essential for accurate diagnosis and effective treatment planning.